Filipino nurse shares her experience of family members diagnosed with COVID-19 during the pandemic. Changsha Tzu Chi volunteers care for parents who lost their only child regularly in China. Welcome to DaAi Headlines. I'm Maggie Tsai. Thank you for joining us. The number of COVID-19 confirmed cases in the Philippines exceeded 80,000. In addition to physical pain, the confirmed patients have to face psychological pressure because of their ignorance of the disease. Annie, a nurse, showed up to share her experience of her family diagnosed with COVID-19 in May this year.
In the picture, Annie's family of 4, even wearing masks, can hardly conceal their joy. They were celebrating Annie's husband's 51st birthday. They didn't expect he would fall sick the next day.
His cough became more and more serious. Even though he has taken antibiotics, he still suffered from high fever and diarrhea, making him hardly sleep.
The 2 children and the domestic helper lost their sense of smell and taste one after another. The whole family went to the hospital for screening. Unexpectedly, the husband was diagnosed with COVID-19 and also complicated with pneumonia.
If you are infected with COVID-19, you need to prescribe the right medication and straighten your immune system. Don't think too much. Once you become anxious, you will not be able to sleep peacefully, which will reduce your immunity.
Kung ano na pumapasok sa isipan natin, hindi tayo makakatulog, hihina yung resistensya natin.
During the quarantine period, the whole family stayed together every day, which was also an unusual experience for this family.
Naging close po kami as a family.
Our family relationship is getting closer and closer because we share the same room in the hospital, so we were able to do things that we have never done before together.
After 1 month of treatment, Annie's family was discharged from the hospital. Annie is a nurse. After experiencing the threat of the virus, she returned to work and continued to serve patients.
After contracting the virus, I became braver. I can go out to face other people. At this special moment, I will stick on my pole to serve patients and help doctors.
Dooley is a premier contemporary storyteller of the Navajo people in the United States. Dine is her first language, but she has been able to transpose ancestral stories that transmit the Navajo worldview into English, and she used it to share how COVID-19 has been an eye-opening experience for her.
بتزيد هدول كده بهجون هدول أدو إنت كونشد النادات إندي بتخيادا هاد إيهو إيا كنادا هاد إينو بنيا. This corn, my ancestors brought it, and we've planted it, and we've cared for it. Dina daltswi e benaido kan. Konshik edad abel kesht enigi. Di keya waka e dole. Whatever it is that seed experienced while in my presence is embedded in that seed now. Eitna e kon khalch eltki khalch e wan. Hojo nasli, hojo nasli, hojo nasli, hojo. All of my ancestors' embeddedness is in that seed. It doesn't end with me. I'm eternal. I am a Navajo storyteller. I graduated from college. I lived in New York City. I've traveled around the world. I've seen it. And every single time I come back here, I know that, you know, the oak tree, the pinon tree, the juniper tree, the sagebrush, all of this right here knows my name. My work pretty much stopped in the context of telling these stories in public schools, at different venues for presenting. They're all gone. But I still am here presently observing everything that the virus has done to my people and noting it. I look up and I see these beautiful cloud formations. We have had clouds of every kind since airline travel has been practically at a standstill. I am enormously grateful for that. I got to see it again before I die. This was the kind of sky I grew up under. My heart goes out to pilots and their families. My heart goes out to all of those people that worked to maintain the airplanes and the airports. You're gonna go catch another one? Alrighty. It's a baby. Oh. This yet does it have a name? But Muppet, is Mama gonna cry after it? I really, really do hope that we begin to acknowledge what is sacred again about life. For them, okay? Yeah, take it back to Mommy. COVID-19, for me, personally, has been an eye-opening experience for us to understand that we each have a divine place of stillness. There they are, the all-stars. And it shouldn't frighten us. We should ask it to invade all of our being. Physically, psychologically, emotionally, intellectually, and most importantly, spiritually. All of my ancestors, they're with me. I hear their voices in the wind, in the rain, and in the clouds. Even though I am what you would see as a single woman just living out here, I am so loved here. I am cloaked in affection.
Kaohsiung DaAi Kindergarten carried out a cleaning of the whole campus. Volunteers, mothers, and students took advantage of this summer holiday to clean together. Due to the current epidemic, many parents were reminded about the importance of protecting the earth through a vegetarian diet.
In freshman experience camp of DaAi Kindergarten, new students and their parents need to become familiar with the school environment first.
Because of the epidemic, I think that the resources of the earth are needed to be protected, so I hope my child can learn some good behaviors for the earth here.
Because of COVID-19, many people have been willing to learn Buddhist teachings. In the coming semesters, there are several new mixed-race students.
It's more environmentally friendly. Because of the recent epidemic, I want to seize this opportunity to bring him here to learn.
The epidemic is quite serious, so I think being vegetarian is best for the environment and ecology. Our whole family are all vegetarian.
Everyone should go meatless to protect the earth. During the cleaning week, both adults and children join together to clean. Children in the classroom help mopping the floor, while the adults outside the classroom climb up high to dismantle the fence for cleaning.
Because of the epidemic this year, we are also worried about our children's health, so we come together to clean the school.
Not only are the present students coming back for cleaning, but also graduated students came to clean.
I came back today to help clean up, so that the younger students can have a safe and clean school.
They work together to maintain the cleanliness of the school so that the epidemic will no longer spread.
Have you heard of the saying that eating vegetarian food can help with the skin? Children who adopt a meatless diet may also grow up healthily. Two doctors from Taipei Tzu Chi Hospital recently shared the benefits of a vegetarian diet through streaming on Facebook.
吃播用肚子翻滚术的大台北。
The director of the dermatology department at Taipei Tzu Chi Hospital, Wang Chenhua, and pediatrician Cai Wenxing have been hosting medical programs for many years. This time they share the benefits of vegetarianism on Facebook. Wang points out that adopting a vegetarian diet can prevent tanning and help whitening the skin.
There is abundant vitamin C in vegetarian food, which is very important for us dermatologists. It can promote collagen citizens and facilitate healing of the wounds. Most importantly, it can help whiten the skin. Dietary fiber can help our digestive system, so we can go to restaurants without problems.
Dr. Tsai shares her experience of eating vegetarian food during pregnancy. She gave birth to a healthy baby and had enough milk for the infant. She also gave her suggestion about children adopting a vegetarian diet.
Tofu and soybean drink provide good source of protein, which is as good as meat protein. We suggest that people eat whole grain food, which has starch and protein. It also contains abundant minerals and dietary fiber, so children will not gain weight easily.
While listening to the experts' opinion on vegetarianism, you can also try to embrace vegetarianism and enjoy its benefits.
Caregivers share the physical and mental pressure of taking care of the ill, and though some people think the salary is quite high for their work, it takes 24 hours a day. Lu Xiangling has been voicing for the rights and interests of caregivers for 20 years. Let's hear what this righteous fighter had to say.
Most of our caregivers are like this, simply carrying their things in a piece of luggage and doing itinerant work.
This is the daily routine of the caregiver. When working in the hospital, they have to drag their luggage with them because they don't know if they will be in the hospital with a patient for several months.
This is my slippers. It is stipulated that in the hospital, we should use our shoes from morning to evening and can only take it off when we take a shower.
Lu Xiangling has been engaged in the medical care work for 20 years. Patients staying in bed require her to provide 24 hours service, so hospital has become her second home.
At the time of SARS, we were really in a pitiful state. We couldn't buy a mask. At that time, we went to the gas station and tried to get masks and then wear them back. The hospital did not provide us with masks. They said, "You are not our employees, so you cannot get masks." But we are on the front line and in direct contact with patients, so if we didn't have masks, we would be very worried.
The work of the caregivers is in fact within the medical system, but they are not considered staff, so there's no guarantee for them despite these high risks. Compensation under the Occupational Accident Labor Protection Law is limited to death due to occupational accident and disability due to work. If the accompanying illness is due to an infectious disease and does not lead to death or disability, they will not get a dime.
If nurses or cleaners contract coronavirus during work, they can receive $10,000 US. But what if a caregiver is infected? Can he or she get this money?
Making such money as a caregiver is often the last resort of economically weak social groups. However, Lu Xiangling still feels a sense of mission and set up a labor union to take care of the rights and interests of those in the profession. She said that this kind of work requires respect from society.
Some employers even treat caregivers badly. While you are eating lunchbox, his daughter-in-law sitting next to him asks you to serve him a cup of tea. Sometimes they would complain the tea was too hot or too cold for drinking. These old people think they own you because you are paying your salary.
In order to make money to support her family, Lu Xiangling takes care of other people's families, yet she has little time to spend with her own children. In 1999, the Chai earthquake, which was 6.4 on the Richter scale, knocked down 7 houses when she was working in a hospital.
When I heard the news, I was worried about my kid as she already finished school and returned home. I felt bad because our house was so tall and my child was alone at home. However, I had to accompany the patient and couldn't leave him for going home temporarily and ask someone from his family to come to take care of him.
Mom might feel very nervous, but we seemed to be okay at that time. We just left school early because everything after school was the same, and there was usually no one at home. So no matter what day it is, there is no one at home.
真的，我以为你会跟妈妈一起煮。
连蛋都不会煎的。我女儿以前葱跟蒜啊，她说啊，那长得什么样子？什么是葱，什么是蒜，她完全搞不清楚。
In order to make up for her child who always had 3 meals a day outside, Lu Xiangling now does her best to cook at home every day.
应该说家里面如果有一个患者的时候
If a family has a patient needing hospitalization, the whole family will be thrown into chaos. If at this time, when there really is a caregiver who can come and take care of the situation, the family will become more stable. It is like having another mother, so I take pride in her work and that it is a good career.
A caregiver is someone who can help stabilize society. For a retired principal who is more than 80 years old, his daughter is married and his son immigrated abroad. He lives alone. Fortunately, he is accompanied by a caregiver.
我就会先观察患者的情况。伊若是讲就像咱假设来讲，咱来参校长安尼的这种类型的患者，我拢会甲家属讲。
I will first observe the patient's situation. Assuming that for patients like this principal, I will tell my family members that I have a principle of taking care of the patient, that it is better to have emotions than no emotions at all. For example, I just squatted down to raise his feet and he started to give instructions about what to do. I took a breath and looked up at him. I said to the principal, I want to be fast, but I can't help it. My movements are fast, but not as fast as your mouth. Then we just stared at each other and later his eyes softened.
They have been accompanying each other for more than 2 years, and it's not just about taking care of life. They talk and make jokes every day. Maybe it sounds nothing to others, but for the principal living alone, this personal interaction is very valuable.
Family losing an only child is a phenomenon unique to China. In the past, one-child policy was implemented for a long time. Couples who passed into middle age whose only child died unexpectedly were unable to give birth or adopt children. Tzu Chi volunteers from Changsha care for these families regularly and alleviate their regrets with love.
就是虽然我们不能感同身受他们的痛苦，但是我真的有点想流泪的感觉。孩子已经去世，有的是9年，有的是12年，但是对父母来讲的话，他是永远是无法去抹平的那一种痛。
Grandpa Yi, who lost his only son, raised his granddaughter by himself. After retirement, he did not expect to have cancer. Volunteers went there to comfort him with positive thoughts.
Why do I want you to be grateful for having this disease? Because it stops you from smoking, right? If you don't have this disease, you would still smoke.
Giving him nutritional supplements and also advice, volunteers want to let Grandpa Yi know he is not alone.
This is blessing charm, symbolizing peace and bless you. We belong to one family.
The 2 seniors of the Fan family have also lost their son, and their only grandson suffers from developmental delays, so Grandma Fan is very worried.
Your good words are the best blessings to him. We are all his seniors and hope he will be fine, right? Let's say more good words to him.
Chi Chi volunteer Tang Zhuozhuo was also raised by her grandparents. She had the same experience and comforts the 2 seniors.
I will always remember my grandparents' love for me, so you should also let him feel your parental love to him.
More than half of the visitors participating in the home visit this time are entrepreneurs. Seeing the disadvantaged groups in society are in need of care, they have been deeply moved.
This time, my biggest feeling is the preciousness of life. Within our ability, we should do what we can, and no need to think too much, but to cherish every single life.
Volunteers' care alleviates their regrets of losing their only child, filling their empty hearts with love once again.
In Kuala Lumpur, Malaysia, an 89-year-old man named Balan lives with his sister. For a long time, Tzu Chi volunteers took care of the brother and sister. Upon one visit, volunteers have discovered Balan's poor health situation and immediately took him to a doctor.
Three volunteers took Balan to the doctor. From registering to receiving medicine, they never left Balan.
We felt weird seeing Balan not responding to the door knocks. His sister told us that Balan was not feeling well. She went in to take Balan out. Balan told us that he has back pain along with problems in his respiratory system. We immediately took him to the doctor.
Balan suffered from long-term bloating. Volunteers once again reminded him of the doctor notes he had just received.
You have to eat easily digestible food since you are old. Kangi is good, so you must drink hot and warm Milo.
1 pill at a time with a total use of 3 times, separately morning, noon, and evening.
Balan lives with his sister. Tzu Chi volunteers' visit made their lives better and safer.
Do not drink the yellowish water, which is for flushing the toilets. You can only drink clean water.
After seeing the doctor, Balan felt safe and energetic. He started eating again.
Thank you for bringing me to the doctor. After using the prescription, I felt much better. In a few more days, will only get better. Thank you so much.
Balan and his sister, under the assistance from Tzu Chi volunteers, felt the natural love of a family once more.
When temperatures are high, many people reach for antiperspirant to stop sweating. However, there is some information out there stating antiperspirant, when used on the thyroid, can increase the risk of breast cancer. Is it true? Let's find out in our following report.
On a hot summer's day, sweating not only makes the body sticky, there is often an odor attached, which may be embarrassing. Many people reach for spray or stick-type antiperspirants to block sweating, but there are rumors that using such a product on the armpits increases one's risk of breast cancer. Can it be true?
There are many factors that could cause breast cancer: gene makeup, hereditary, and even environmental factors. Do antiperspirants cause breast cancer? Both the American Dermatology Association and Taiwan Dermatology Association still don't have a conclusive answer for that.
Currently, antiperspirants and breast cancer are not linked together, but it's important to use the product at the right time if one wants maximum effect from using antiperspirants.
Application is suggested the night before after a shower when the skin is clean and dry. The next day, you can feel fresh leaving the house. A reminder to not apply it when you have freshly shaven or if you have open wounds in and around the area.
There are many different types of antiperspirants out on the market. Doctors remind you to pick ones with FDA approval number for safety guarantees. Also, if you have sensitive skin, it is suggested you choose ones which are natural and paraben-free to lessen irritation.
A travel company owner rented a tour bus to invite underprivileged children to a city trip. Take a look and goodbye.